The program will now begin.
Welcome to this conversation with an extraordinary group of women peace builders who are on the front lines battling COVID-19. I'm Melanne Verveer, the director of the Georgetown Institute for Women, Peace, and Security. And today we will be discussing the impact of the pandemic in conflict-affected areas. We are all experiencing COVID-19 and its impact in different ways. But imagine in conflict-affected areas where war has been raging, where the people in those places, particularly the women and their families, have been suffering greatly with deprivation, with displacement, and with all the consequences that war brings. And now COVID-19 has struck. We will hear from our panelists on the impact of the virus in the places that they know best and in where they have been working. We will also want to discuss the way forward. What does this mean for peace processes, for the role of women in dealing with the pandemic? What should all of us be doing, the international community and governments and other NGO actors around the world? And we will want to hear from you, our listeners and viewers, with your questions to our panelists. You can submit your questions at any time during the discussion. Use the Q&A feature on your screen and just include your name and organization, and note if your question is targeted to one of the panelists who you are directing the question to. There are more than 1,000 of you participating in this discussion today. You are on the line from across many, many time zones, and we welcome each and every one of you. From India, from Sudan, from Rwanda, from Colombia, from El Salvador, from Afghanistan, from the Philippines and Morocco, and so many other places. And so now let us begin so you can hear from these extraordinary peace builders. I'm going to start now and with the discussion with Rajaa Altalli. Rajaa has been working on the front lines in Syria. We are reaching her today in Gaziantep in Turkey, which is about an hour from Aleppo. Rajaa is a Syrian women's rights activist and co-founder and co-director of the Center for Civil Society and Democracy in Syria. She was one of 12 women appointed to the Women's Advisory Board by the UN Office of the Special Envoy, at the time Staffan de Mistura, and that board continues to operate. She has focused on ensuring that women's perspectives and leadership are taken into account in any eventual peace process. Rajaa, tell us what is happening now on the ground in Syria. How is COVID-19 impacting your community, your peace work? And will it fuel an already terrible conflict, or will it possibly de-escalate the conflict? We're eager to hear from you.
Thank you, Melanne, and hi everyone, and thanks for including Syria in the conversation on women, peace, and security as well. So 9 years ago, Syrian people have taken the street in order to demand freedom, justice, and political transition. And through the 9 years, Syrian people have suffered from bombing, siege, chemical weapon, and you name it. It's up to like 2 months ago, only bombing was continuing. Millions of Syrian people have been displaced either internally or outside of Syria as refugees. And now, like what the Syrian people are saying, after all this, we are more immune for COVID-19. It's not correct. Syrian people are suffering a lot because of COVID-19, especially the Syrian detainees who are already in a very bad shape. And, you know, like the horrific Syrian detention is well known around the world on the situation that people are dying every day from torture, but also because of the health situation in the detention center. IDPs, we are talking around the world that social distancing is a very good thing, but there are children, there are Syrian men and women. They see it as a luxury to even talk about social distancing. And I'm not talking only about the people who are in the camps, but also the people who have been displaced in the last 2-3 months, within 2-3 months, as million in the Northwest. And they don't have the luxury to do social distancing. The Syrian refugee, like only 3 weeks ago, one Syrian refugee in Lebanon has burned himself because he is not able to pay for the rent, to pay for his children, etc. So those are marginalized people in Syria. They need the support. With that, CCSD has been calling for the ceasefire to continue and hold in Syria, and in the same time pushing for the political process. COVID-19 could be an opportunity for peace in Syria, and this is based on 2254, and the international community and the UN can help in pushing the political process forward. Also, advancing a human rights and women rights agenda in Syria is a vital issue, and supporting Syrian women and Syrian civil society who is doing a great work in protection and prevention from COVID-19 in Syria to be supported.
So there is the possibility, if a ceasefire could be executed, that might eventually lead to the kind of peace that's been elusive in all of these years.
So,
go ahead.
Mainly, like if we need the actors who are involved, and you know, like the Syrian crisis, it's not a Syrian crisis. It is a regional and it is an international crisis. And this is where, like, while we are calling for a comprehensive response for COVID-19 in Syria, like COVID-19 doesn't know geographic boundary, doesn't know even like ethnicity or religious boundary or political opinion. And this is why, like, the actors around the world needs, who are involved in the Syrian crisis, they need to come together and say that enough is enough. 2254 has been agreed on in the Security Council since December 2015, and a peace agreement could happen on the virtual world. We are connecting with each other. Military weapons is continuing, even though with COVID-19, peace is the one who should be continuing because of COVID-19, not the militarized solution.
Thank you, Rajaa. Let's turn to Wei Wei Nu, who is the founder and director of the Women's Peace Network, Arakan, in Myanmar. It's an NGO that conducts trainings and civic engagement in Rakhine State. And also she's involved in Justice for Women, a network of female lawyers providing legal assistance to Burmese women activists. Now, Wei Wei's been engaged in bolstering peace-building efforts in Myanmar for some time. And I want to ask you, Wei Wei, we have heard so much about the million-plus numbers of refugees in Cox's Bazar in Bangladesh. There are also so many in Rakhine State who are suffering greatly. It's already been disastrous there before this terrible virus has come forward. What is happening with the onset of COVID-19 there? How is it impacting your work? I read the other day that a WHO worker was fatally shot. Can you give us a sense of how a grim situation, what has happened and what continues to happen? How is that being aggravated?
Thank you very much, Melanne, for this opportunity to share the situations in Myanmar and in Bangladesh. First of all, as you said, these are victims of international crimes, victims of the crimes of genocide. And I want to highlight that, as Rajaa mentions, the COVID-19 pandemic actually added another layer of pressure and vulnerability to the most vulnerable population, people. And in most cases, the WHO's COVID-19 prevention guidelines on social distancing, hand washings are simply impossible to practice there. In Bangladesh, as you said, approximately 1 million Rohingya from Burma are living in overcrowded, squalid camp, often sharing 10 square meter of tent, makeshift plastic tent by average 6 members of family. And again, the restrictions and limitations on the access to internet create increased frustrations and fears among the refugee populations. And basically, yesterday and over the last week, I've been talking to many of our volunteers and youth and women in the camps. They are simply saying that, yes, we are scared of the COVID-19. On the other hand, we feel like we are going to die before COVID-19 hit in the camps due to the hunger and starvations. Although the government of Bangladesh and INGOs and aid groups are trying to secure aids and distribute necessary prevention materials and food. However, it is the distributions of rations and necessary goods are very limited to the needs of the human populations in the camps. For example, when they distribute rations, it's mostly rice, beans, and oil. So they still need a lot of other like food, essential foods and other materials, and people are fear of they cannot go outside, so people are fear of starvations at this point. So they really feel like they're going to die before in the next couple of months if this goes on. So there should be another way of solutions. On the other hand, as I said, they're living in very small tents by sharing many members of families, and at the same time they still have to share like bathroom, so there is no adequate personal hygiene. And there aren't adequate personal hygienes, and some aid group has already distributed like soap bar. However, there aren't enough water for them to really wash hand. And not only social distancing is a luxury, but also like even washing hand is a luxury for them. They don't have water to wash their hands. So in my opinion, these situations is really, really frustrating in a way that any of those prevention guidelines are not relevant to the conditions in overcrowded refugee camps or IDP camps in Rakhine State. At the same time, people in lack of information create fear and frustrations among the refugee populations in Bangladesh. In Rakhine State, again, we have over 1 year of internet blackout in Rakhine State in Myanmar. People are really, like dying every day. We are seeing increased number of civilian casualties due to the ongoing civil war. Although, despite of UN Secretary General calls for the global ceasefire, Myanmar military has actually intensified the fighting, the attack in Rakhine State against it's the war between the Arakan army and the Myanmar military. However, it seems to us that the the Burmese military is continue targeting the civilians and even the aid workers and humanitarians groups. As you said, this week the WHO driver was shot and killed in an attempt to deliver COVID-19 test sample, and this is situations in the ground. It's simply very, very difficult for situations for the Rohingya and Rakhines and other ethnic groups in Myanmar, as well as the situations in the camps in Bangladesh is really also dire and really I guess, as I said, I would end up and saying that it's added more frustrations and vulnerability to the already vulnerable population.
Well, that's a very sobering assessment of what's going on. And when you think about, death by starvation, death by war, death by raging disease, these are a terrible series of prospects facing so many suffering people. We're going to move now from Myanmar to the Democratic Republic of Congo, in Eastern Congo, to Chouchou and Namegabe. Chouchou is in Goma, where the conflict in that area of Eastern Congo has been going on for many years. Many armed groups have been involved. Those of you who follow the situation in the DRC are aware of the extensive use of rape as a tool of war, of displacement, and now a new outbreak of Ebola there on top of COVID-19. Chouchou is the founder and CEO of ANZAFRIKA, a global initiative to accelerate economic progress for women, which we know is also critically important. And she's also, and when I first met her, she was starting the South Kivu Women's Media Association, which has been using journalism to fight against sexual violence and promote women's rights. So Chouchou, this is a conflict in which you've been having to suffer through for a long time now. How is this new problem of COVID-19 impacting the situation in Eastern DRC? And what is happening to women and their families who have been going through very difficult times and now have to face the prospect of a new pandemic on top of Ebola and on top of a war?
Thank you, Melanne, and thank you for this discussion again with you. I'd like to say that COVID-19 has worsened the situation in the eastern part of the Democratic Republic of Congo. As you know, the president has declared the state of emergency, and he's trying to adapt measures to the context and not imposing a total lockdown, but to ask the people to respect hygienic rules, 2 meters of social distancing, and wearing face masks. But on the ground, people are still suffering. In the eastern part of Congo, there are still attacks on civilians, like in Beni. Last time it was in Masisi, and in some part of South Kivu. There are still attacks on civilians, on people by rebels group, foreign rebels group. And women are the first to suffer of this situation. And what I'm really more worrying about is the socioeconomic consequences of the measures taken to limit the spread of the virus in the Congo. As you can imagine, like in all African countries, people have to struggle every day to go out to look for food. They have to work every day. And here we call it auto du jour. You have to live every day, day by day, to look for food. And this situation of lockdown, because the borders are closed, We are in the eastern part. We are at the border with Rwanda, with Burundi, with Uganda, and as you can imagine, women, thousands of women live from cross-border petty trade. And from this situation, they've lost all their main source of livelihoods. And we are praying, Lord, that the situation of COVID-19 don't reach rural areas or displacing camps. You know, we have internal refugees in our countries. We still have many refugees camps internal. So we are really praying, God, that the COVID-19 don't reach that popular neighborhoods like camp, refugee camps, or rural areas. And it's not only this economical situation, but we have another problem here in the Eastern Congo. We still have Ebola virus. So at this moment, we were thinking that the Ebola was under control, but it's now 1 or 2 weeks, there have been 5 new cases of Ebola. So the country is fighting two main viruses. It's not really easy. And I said, the severe problem is the disruption of the chain of food industry. And really this month, now it's a month of, since the lockdown started, people are, I don't know the difference between poverty and starvation, because really there are lack of food, and there is a potential famine coming to us after the COVID-19, and even to worsen the situation of conflict and insecurity and attacks on women. And the last time I talked with some journalists who are still at Frontline, you know, despite the coronavirus, they have to go on the ground to record news, to make reports. And they said, women really, they said, you know, sometimes they were going on the farm to farm to go to their work, daily work. And they said really, they don't know how they will fight coronavirus and the famine at the same time. Yeah.
That's very, very, very difficult. And I'm glad in a way that you also injected into this conversation the whole issue of food security, of starvation, because there are increasing reports about how hunger is now going to just exacerbate what already has been happening in terms of the consequences we know. So the whole economic piece, the lack of livelihoods, and leading to starvation. We're going to end this first part of the discussion with Oksana Potapova from Ukraine. She is joining us from Kiev, where she is a peace activist, a member of the Women's Initiative, One of Us, and co-founder of the Theater for Dialogue, an NGO working with conflict-affected communities. She's been very actively engaged, which is how we know her so well, in terms of women, peace, and security, and the efforts that women in Ukraine are making. Oksana has, let me just ask you, the war has been going on in Eastern Ukraine for, I think, some 6 years now. Right. There are at least 1.5 million internally displaced, something that I think a lot of people aren't aware of in terms of the consequences there. There have been efforts to secure a ceasefire, but there have been repeated violations. In fact, I saw additionally a headline this week that said Russian-occupied Eastern Ukraine is a ticking coronavirus time bomb. So give us a sense now. We've moved from Asia to Africa to the Middle East. What is happening now in the heart of Europe, in Ukraine, with this pandemic that's going on in a war zone, and what are you and other advocates and activists trying to do?
Thank you. Thank you for inviting me to this platform. It's actually a great responsibility because I know I will be sharing on behalf of many women activists and many communities, including members of my own family who are living in the east of Ukraine. I come from that region, and it's one of the reasons why I've been involved so deeply in working with the effects of conflict over the last 6 years. What I want to highlight is that there's both definitely a humanitarian aspect to this crisis in terms of how the communities, conflict-affected communities, are now affected by the COVID. There's also a larger issue of advocating for a more comprehensive women, peace and security agenda at large that we as feminist women peace builders have been trying to do over the last 6 years and are continuing to do now. Speaking of the Donbass region, you are right in naming the numbers of internally displaced people. As of recent numbers, around 58% of this 1.5 million are women. Many of them are women living alone with their children. Many families are separated or have separated as part of the conflict. Before the beginning of the pandemic, there was a lot of movement between the so-called republics, the temporary uncontrolled territories of the Donetsk and Luhansk republics. Now the movement has completely stopped, and the borders are closed, which gives us little information of what the situation really is. But from everything that we know, and the human rights monitoring shows that the population of the uncontrolled territories is largely people of pension age and elderly people. And as we all know as well, it's a population at risk for contracting the virus and from suffering from it strongly. This creates, as you mentioned as well, a high risk of contagion. At the same time, what we see and what we know is that the leadership of those territories is not taking the situation as seriously as it would have, we would have liked it. So we have no estimation of exact numbers of cases. It's very little that Ukrainian government can do, but what the women peace builders are doing all across the country, in fact, is providing information about the health measures and the importance of staying home and sanitizing yourself. We're also talking a lot about the importance of access to health infrastructure right now and after the borders are open, because this is the first thing that will serve the needs of the people. And due to poor roads, due to little access to hospitals, it is an issue, and it continues to be an issue in the conflict zone and across Ukraine. The other issue that we are seeing as a big challenge, not only in Ukraine, I'm sure, is the increase of violence against women, domestic violence and gender-based violence, and lack of systemic responses to that. One of the examples is that after the setting up of the quarantine measures, which are still in place in Ukraine, the police has started to use a lot of its own force to actually monitor the violations of quarantine and not be so active in responding to cases of domestic and gender-based violence. So it tells us something about the priorities of the security system. And again, we want to stress that feminist priorities are gender-based violence first, and responses of the security system towards that. And one of the things we are doing and have been doing as a women's movement is mobilizing to sign a petition for the ratification of the Istanbul Convention, which would provide us a systemic response to the situation with gender-based and domestic violence. Ukraine has signed this document but hasn't ratified it due to a strong influence of conservative groups. So I think what is important for me to stress is that along with humanitarian increase of challenges, there is increase of gender-based violence, and the necessary response is needed, as well as the economic vulnerability. Also leads a lot of women to move back with the perpetrators, including women in the conflict zone, including women in the zone close to the conflict. And when we talk about security right now and post COVID-19, we must talk about economic empowerment of women. We must make sure that this situation doesn't lead to disproportionate firing of women, which is also already happening. We don't have statistics, but we are receiving information about cases of women being sent on unpaid leave or being asked to take the unpaid leave unofficially. So we don't have direct statistics, but we know that gender discrimination is happening at the workforce right now, and it will have long-term effects. And when we talked to women in communities about security, with internally displaced women, with women affected by conflict, they told us that the second thing they fear most after shelling or bombing is not having enough income to provide for their families. So we must stress that looking beyond just ending war, looking beyond just stopping the pandemic, we must use this momentum to transform policies and narratives and discourses to make sure that we live in a world with just and sustainable peace for everyone.
Thank you so much, Oksana. And I'm really glad you raised the issue of the spike in domestic violence and the conditions that are now making the situation that many women have confronted around the world that much more difficult. I thought the point you raised in terms of the police looking to do the social distancing and making sure that those requirements are being adhered to, and ignoring pleas for help that come out of this spike in domestic violence is one that we're hearing about in other places as well. And again, the economic livelihood issue. I want to put one more series of questions to you before we turn to our audience. And let me just continue with you, Oksana. You've already raised some very important questions that need to be addressed. What other kinds of responses should we be seeing from the international community, from government, from those of us who are engaged in NGOs and in other ways to this issue? And given the fact that you are a peace builder and a leader in terms of women, peace, and security in Ukraine, what do you see happening in that space? What needs to happen to push a real sustainable peace in a way that needs to be fully understood and incorporated?
Thank you. Indeed, it's a question I could go on to answer forever. And I'll just mention very, very briefly some of the things that women on the ground are doing already on different levels. They are, as I mentioned, involved in providing information in different formats by social media, going on television and radios. And there has been no lack in accessing information for communities. Women are also organizing to provide psychological and emotional support to the communities that are at risk and to deal with the stress. As I mentioned, we're also mobilizing our women's community to push for ratification of the Istanbul Convention. And another thing that is happening, which I think is important and leads me to answer the second question, is we're seeing an increase in feminist analysis and advocacy around gender impacts of crisis. Women's organizations, international organizations, and local organizations are more sensitive to this now, and we think that we cannot miss this momentum. So I have been spending a lot of time actually reading articles and research, talking to my colleagues in different regions, as well as interviewing women peace builders and leaders of organizations to see what we as a group need. I just want to say that, often we call women leaders, women peace builders resilient, and that is true. However, this term comes kind of with a price. Sometimes resilience means you'll just always manage it. When another crisis comes, you're just gonna pick it up and save the day again. So why don't we lay back and enjoy watching you do it? And when I was preparing for this presentation, I really thought that I want to shift that paradigm. I want for women not have to save the day again. And for that, we need sustainable policies and structures. So one of the things I think is really important, which we unfortunately don't see happening in Ukraine, is that women need to be involved in decision-making now, not after, not later, but now. A lot of bodies that have been set up on local and national level to respond to the crisis, unfortunately, don't consult with women's civil society, don't integrate gender analysis in their work for lack of capacity or lack of awareness, but it's not happening, and it's very alarming. It's an echo of the peace process that is also very gender blind, and that again risks to miss out the perspectives and the needs of women. So one of the things that needs to happen, I think, is put gender analysis and a consideration of needs of women, especially vulnerable groups of women, intersectional gender analysis at the core of any decisions we make, especially as international organizations come in to partner with donors, with governments and with civil society, increasing capacity for gender integration and increasing accountability for consideration of women's voices is key, I think. Another one is, I believe we need a change of narrative and a change of story. I've been hearing a lot of discourse around we are fighting this crisis. It's an enemy and we are at war. And once again, we are using a militarized discourse while we can replace it with the discourse of care and support, solidarity and equality. And this is what I think a feminist agenda can offer. We have seen that reproductive work and the care work is what is saving us, and most of this work is done by women. I think it's time to put value to this work. It means not only changing the discourse, it also means changing the funding and the priorities that our governments invest in military spending versus public funds, healthcare, education, infrastructure. And those are the things, again, we have been talking about and we continue to talk about now. And one of the areas that's coming out is the focus on labor rights and how inefficient labor legislation is putting women at risk of being unemployed or being unofficially employed. And the rights of workers is something that I think needs to be on the agenda, especially these days. I want to say that in all of this, this is a long-term haul, what I'm talking about now. Of course, we need an immediate response right away, and I've already mentioned some of the measures that are being taken. But I cannot stress more the role of women's organizations and peace-building organizations in a moment like this. Because even though activities on the ground have stopped, obviously a lot of our work is based on dialogue activities, workshops or meetings or roundtables. The quality of connection and trust that we have built is still there. And I think the international community needs to rethink the logic of what is considered an efficient program and what is considered a result of the program. Can a network of organizations, can an effective trust relationship be enough of a result of the program? There is risk that some organizations may lose their funding now because they cannot do activities on the ground. I think we must not let this happen. We must support the livelihood of organizations, provide institutional support, provide spaces for self-care and community care for women peace builders themselves who have been traumatized and burned out from the work, and make sure that as we come out of this, the civil society is stronger than before and is not also scrambling for resources, because the civil society, the women's civil society, is the glue that is holding communities together and will hold them together as we come out of this situation.
Well, thank you very much for that. I think you have put forward a number of action areas in which we should all be focused. We hear again and again about how women are not being involved in the decision-making processes when they are, on the front lines, and enormously capable and experienced in terms of making contributions as leaders, not just as people being impacted by this ongoing challenge that is confronted, as well as the funding issues have come up. I think that's another really important area to stress in terms of women's organizations and the long-term need to continue this investment going forward. Chouchou, same question. What kinds of responses would make the difference now, and what should we all be focused on?
Thank you very much. And yeah, I'll give our experience. As ANZAFRIKA, we started first with sensitization. It's really very important because it's a new virus. It wasn't known by people. And we started making videos, vocal messages to sensitize people. And as usual, you know, women journalists are at the front line. And they are heroes too, because they are still working to give news. And so to protect them, ANZAFRIKA distributed reusable face masks to them. You know, here in Congo, the face masks available in pharmacies, sorry, are very expensive. So now in Bukavu, my hometown, for example, the population has been asked to sew its own homemade masks and to wear them when leaving the house. This is one of measures adopted by Dr. Mukwege, who is leading the commission, the medical commission to fight against COVID-19 in the province of South Kivu. And so Dr. Mukwege, as you know, he's a Nobel Peace Prize 2018. He has adjusted some COVID prevention measures so that women can still go out and look for food for their families. So it's a gender sensitive measure. And now in sensitization approach, the local media here in my country adopted to use a fluid language so that people can understand what does it mean COVID-19. And instead, for example, of saying wear a face mask, they talk about cache-nez et bouche. I don't know, in French it's hide nose and mouth. So instead of saying face mask, that's to avoid misunderstanding, because you know, the Congolese are very innovative. We could see people wearing inappropriate materials as masks, such as bra or diapers. You could see people wearing diapers as masks. So, but as we are turning into a recommendation, I think the strong response towards is a strong community involvement. And as for Ebola, my country has learned a lot about how to tackle this kind of epidemic. And the first solution is to involve communities and ordinary people, and among them, women. The women, they know what solution will work for them, but unfortunately, they are not involved in decision making. They are not they are not leading the commissions. Sometimes they are even forgotten. For example, lockdown cannot be imposed without all the consent of the people affected. And this measure should be gender sensitive. And I remember really when we were in the middle of the Ebola outbreak, there were hand wash points every mile in the city, and people were obliged to stop and wash their hands. And it's still that good habit and behavior for them to fight against COVID-19. And yeah, as I said, women should definitely be included in full and equal commissions that take decisions. They have to be involved so they can have a response that must be suitable for them and to be at the front line. Now, you know, after a month of lockdown, in Congo. Really, it caused a painful situation in the communities, in the neighborhood. And I think an emergency assistance measures should be really, it's needed here in the country. And because the big issues, as I mentioned, is the potential famine after the COVID-19. So the international community would have to work on that. And my organization, ANZAFRIKA, we are working with women farmers to help them continue farming even for time. Yeah, by respecting measures of social distancing. And we also provide them with adapted farming advices by text message and vocal messages on their mobile phones. And yeah, that is our contribution in the fighting against the COVID-19, also in helping women continue their farmers' work to avoid famine after the COVID-19. Thank you.
Well, thank you, Chouchou. And it's important that you raised the issue of women in the agriculture sector. In many countries, they are the majority of the smallhold farmers. The ability to stave off starvation in many ways will be due to what they are able to produce. So I think assistance in that arena and community engagement, women-led community engagement, and also the issue of information. Both Weiwei raised this with respect to Cox's Bazar, but there's a lot of misinformation. What are people to do? And again, how vital it is to get accurate information to people so they know how to respond. So very good points. Weiwei, let's go to you now with the same question. Weiwei, we can't hear you. Okay.
Right, okay. Well, thank you for the floor again. You know, I think there are, okay, I want to like provide some recommendations in this regard. I mean, first of all, okay, before giving like more broader recommendations, I want to say that in Myanmar military should stop the civil war and, you know, basically call for a ceasefire and stop abuses towards the civilian in the midst of global pandemic. That's the must and the most important thing. At the same time, the Burmese government should remove the internet blackout and allow humanitarian agency to be able to provide adequate humanitarian needs to the people who need in Rakhine State, in Kachin State, and other part of the conflict-affected area in Myanmar. At the same time, to prepare, you know, the response preventive to take preventive measures to respond to the COVID-19 pandemic. Those are very important recommendations. When specifically in relation to Myanmar. And for as far as general recommendations, I would like to emphasize on a couple of things. Firstly, health infrastructures and services that is available, that should be available for the needs of all patients, regardless of gender or socio-economic background, especially you know, to the most vulnerable groups such as refugees and IDPs. And support for the survivors should be strengthened during the COVID-19 by ensuring casework can continue at the risk assessment and safety planning is done and adapt this, you know, adapted to the survivors' need as, I mean, the same. An inclusive and integrated crisis management response and should be considered, you know, given the risks and the impact of the women can be different in the pandemic, and again, the women should be at the forefront of these responses. And some of the important factors should be evaluated and considered, including supplying, like when people supplies the personal hygiene material for the women, it should include like menstruation pads and care for the babies and such. And also in the case of refugees, refugee camps and in the remote area, there might not be like helplines or hotlines available, which is available here in Western Hemisphere or Western countries or developing countries. In that conditions, the need to create supportive volunteer social network it's essential, so that people can basically provide essential needs and as well as the informations. And when it's come to the human rights and protections, I also want to emphasize from ensurance that COVID-19 must not be a reason to stall or stop justice mechanism from supporting the need of women, mothers, elderly, IDPs, and refugees who need support. And rights should not be restricted or restrained during the pandemic, nor should authority use pandemic to justify violence. And we need to continue the protections and promotions of human rights work and peace building work, because these things are not going away. The human rights violations are continuing. The victims of genocides and Rohingyas are waiting for the justice to gain justice for their suffering and for their the crimes that has been committed against them. So I think these are a very important thing. And lastly, for the recovery, the role of women organizations and protections agencies must be recognized when developing the recovery plans and responding to the gender-based violence, as we see the risks of increasing domestic violence and other impact against the women populations. Finally, protections of, I want to remind all of us that protections of all lives is our moral responsibility. So we must also remember that the right to health is human rights and the right to live is human rights. So the world must protect the most vulnerable populations, especially the refugees and IDPs.
Thank you so much for that. And I think adding to what your colleagues on the panel have already said, the stress on ceasefire, ending the violence. So a lot of this emergency work and ongoing work can take place to save lives and to really administer what's needed to the vulnerable. But also the important point of human rights, that it should not be taking a back seat right now. And we see in many of the authoritarian governments in particular using the abrogation of human rights in terms of fighting the pandemic. And I think being very mindful of that and calling that out. And again, what happens as in the way forward when that day comes, when recovery is truly possible, again, ensuring women's participation in that process. And Rajaa, take us back to Syria and the ongoing situation there.
Yeah, thank you so much, actually, all for this very important conversation. I just want to maybe start with find creative mechanism to support Syrian civil society. I would put it as the first recommendation. We are all suffering from COVID-19. I know that. We are, especially the leaders around the world, are taking steps in order to move with the protection, prevention, containment of COVID-19 around the world. In Syria, civil society has been playing a very important and leadership role in order to advocate for an equal right for IDPs and refugees for prevention and protection of COVID-19. So supporting civil society is a key, but also women leader, women civil society, especially in decreasing the gender gap in technology. From this important platform, I would like to call for the help in Syria, but also around the world, for Syrian women in closing the technology gap, especially during COVID-19. It actually showed us how important it is to take 2020 as one of our goals in making it much smaller the gap is. In the human rights sector, I really would like to call for advancing human rights in Syria and supporting human rights activists, a human rights organization, but mainly for a call for the release of the detainees in Syria. Thousands, tens of thousands of people are detained and missing in Syria, and they deserve, their family deserve, they deserve to be released on a humanitarian base during COVID-19. And this is like supporting the call for the special envoy to release the detainees in Syria. And would it be possible to have a creative move in Syria and have a peace agreement online? Would it be the first time, like in the Syrian process, establishing the Women Advisory Board and establishing the civil society support room? It was the first time that is happening. Inclusion of civil society in the Constitutional Committee, it was the first time that is happening around the world. Would it be the creative move to support from the Security Council, to support the effort of the Special Envoy to have a peace agreement online during COVID-19? We deserve peace as Syrian women, as Syrian people, and let's move for a political transition to democracy.
Thank you so much, Rajaa, and for bringing us back to the situation in Syria that has haunted the world in many ways, elusive of a solution that it's been, and with this really interesting proposal about how to achieve a ceasefire even under these conditions, and maybe particular because of these conditions. So let us all focus on that and continuing to support civil society in Syria, which is so vitally important. We're going to turn now in the limited amount of time we have left to our audience. Ali, are there questions?
Yeah, we've got a bunch of questions, so I'll bundle a few here on the theme of women's leadership and civil society engagement. We have one from Nicole Garing and Jaskul Kokorova. How are women's groups lobbying for the inclusion of women in decision-making during the crisis and for gender-sensitive policies? And Cleopatra Modit adds, are social distancing measures shrinking the space for civil society, including women's organizations? And if so, how are they working to overcome that?
And this is directed to anybody, correct?
Anyone, yes.
All right, so those questions bundled under leadership as briefly as you can be, so that maybe we can get into one more round from the audience. Who wants to take it? Anybody on women's leadership? Rajaa, your microphone is off. We can't hear you.
Can you hear me now?
Yes.
Okay, so I mean, the Syrian woman leader during not only the last couple of months because of COVID-19, trying like to overcome the challenges that we are facing. I mean, it's very important to know that like since 2012, actually since 2011, but mainly 2012, that Syrian woman has been like advocating for the participation in the political process, and which resulted like in the Syrian Women Initiative for Peace and Democracy in 2014, and also the Syrian Women Advisory Board for the Special Envoy, but many other initiatives that is really being on the front line. Syrian woman has been on the front line for a while in order to advance the women agenda, but not only that, the Syrian human rights agenda to be pushed like for the future. And now during COVID-19, we are seeing Syrian women who are taking the responsibility in advancing prevention and protection. And it's very important to know that, like in Syria, we are not talking about like one place, one controlling forces. We are talking at least about like 4 areas inside Syria, which has a different controlling forces. And women are reaching to each other, working with each other in order to advance the situation for Syrian people, no matter where we are. We are pushing for a comprehensive response for COVID-19 around Syria. And we are influencing the agenda for responding to COVID-19.
Ali, let's try one more round here.
Yeah, I have 2 here. One on how can digital technology be leveraged to address COVID in your communities? And one from Anand Pawar. What has been the response of men and boys to this situation, especially of organizations engaging with men and boys?
Okay. Again, digital technology and then bringing men and boys into the solution. Who would like to take that on? Okay, Wei.
Yeah, so in our experience, digital technology is one of the most effective way at this time to really leverage information around the COVID-19, where like a country like in Myanmar, like for example, Facebook and the technology become essential. The Facebook is one of the main kind of sources of information for the people, majority of the people. But the difficult part here is that most, like especially in the conflict affected area, and as I said, the refugees and IDP camps where there is no internet or there is no access to the devices, the technology itself, it will create harder for the people to really to have access to information. So I think we have to understand that yes, digital technology, social media, whatever devices can be very effective in this kind of crisis management and information disseminations. At the same time, we also need to address the conditions of internet blackout or access to the internet itself, as well as access to the devices. For example, like for women, for elderly men and women, it's for them, sometimes it's impossible to even have a telephone or any kind of devices if they are a refugee or IDP. So we need to make sure access to the technology and devices, as well as access to the connectivity as well.
And very good. And does anybody want to take on the issue of engagement with men? Chouchou, you mentioned Dr. Mukwege and the leadership role he's been playing. Rajaa, you talked about the UN envoy and the creation of the council. Are there other examples? Are there ways we need to move that part of participation forward to create change in the ways we've been discussing?
Yeah, as I mentioned, we are really lucky to have a man like Dr. Mukwege, and now who is leading the commission, the medical commission to fight against COVID-19. And when really he thought about measures, he included the measure that would adjust on women needs. And he knew, so he knows what are real problems of women. And so he adjusts measures. And I think he had a big influence, because when the government designed a new commission to now to lead another commission to lead the fund for COVID-19, there we saw some women, some names of women appeared. I think he had a big influence on that. We have other movement of men, and he started even a movement of men
I think we,
Yeah.
okay.
Yeah.
We had a technological problem there, Chouchou, but I think we got the gist of your response. Lastly, did you want to say anything, Oksana, on this?
Yes, I try to kind of combine the first and this question as well. Around men engagement on the individual and community level, I've actually heard a lot of positive stories from my colleagues, women peacebuilders, who now continue to work from home and who actually have a different experience of sharing household roles with their husbands. And there's been more awareness raising about that. And it is still one of the biggest challenges, but the organizations are stepping up, women's organizations are stepping up about raising awareness on shared household roles. And there is a potential for transformation there, I believe. I think what can also help us in the long term is more research and more informed conversation about masculinities in general and how the gender binary is taken to extreme in a conflict context and is used to promote violence. And recently we had a book that came out by a Ukrainian sociologist and scholar, Tamara Martsenyuk, on her research about masculinities. And I hope it's going to start a discussion with men, among feminist and women activists about gender stereotypes and gender roles. And finally, to add to the question of leadership, I think informed leadership is what we also need. That's based on data, that's based on analysis. So investing in the capacity of women scholars and women advocates who can ground their positions and their advocacy in data and have informed and meaningful participation is important, and not just have the focus on women doing the frontline humanitarian work, but also strengthen the capacity of women's leadership. And we are seeing that happen in Ukraine. Right now, our government is about to develop a new action plan on women, peace and security, 1325, and civil society is very actively involved in monitoring the implementation of the current plan and in designing the approach to writing the new one. And I think it's a very positive beginning, and I hope that it leads to an inclusive and diverse policy document. And I think we are in a moment where women have enough capacity to contribute in a meaningful way, and that capacity needs to be celebrated and strengthened as well.
Well, thank you for that. And I know that Ukraine's National Action Plan was the first one written in the midst of war, and it's good to hear that it's being implemented and that you are moving on the second stage of that. So thank to all of you. We could have this conversation. I wish we could for much longer. But to Rajaa and Chouchou and Weiwei and Oksana, thank you for participating today, of course, for all of the good ideas, for giving us an eyewitness sense of what's happening in terms of the pandemic. But thank you mostly for what you do every day in this very difficult work of peace building, and now doing it in confronting new challenges. We are going to have to conclude at this point. We've more than run out of time. But before we leave, I would like to announce that at the Georgetown Institute for Women, Peace and Security, we've launched a new initiative called Stories from the Frontlines, Women Peacebuilders in the Pandemic. And we hope that learning experiences like those that you have given us today will not only help our ongoing efforts, but will put a spotlight on the important work that women peacebuilders are doing, have been doing, need to be listened to, and also the additional ways in which you're dealing with the current challenges. And for those of you who are listening in and know of others who would benefit from this discussion, know that this discussion lives on our website and you can access it under events. And we hope that others will benefit from all of the good discussion and the good advice and recommendations. So until next time, stay well and do all you can in these very difficult times and really heed the recommendations, extraordinary discussion today, but also very good advice about how we can better engage with all of you, no matter where we are, and no matter what we do, to really make things a little bit better in these trying times, and to continue the very important work on women, peace, and security. Thank you all so much.